Welcome to another live session with me, Marcus Fernandez, and today we're going to be talking about toothache, the 10 most effective homeopathic remedies that you can use to help you with any of these sort of toothache issues. It's really, really important to know these remedies because if you've ever had toothache, and put your hands up if you've ever had toothache, I know it's very, very painful, or you've gone through teething with a child, you know how extremely painful it can be, and it can just sap your energy, and there is natural ways that you can help with that. And so today I'm going to be sharing that with you. So what causes toothache? Well, it can be many, many reasons. It can be tooth decay. It can be a dental abscess, an abscess in the mouth. You can have a cracked or damaged tooth. You can have a loose or broken tooth as well, or an infection. And this often what happens when a tooth, such as a wisdom tooth, is broken the skin, but does not have enough hasn't come through fully enough. And this sometimes happens with adults as well. But also, you know, after having dental treatment, I've seen many people who've had toothache ever since they've had a filling or some kind of treatment or invasive treatment. So these remedies are really good for that, but there can be many, many causes. And I worked with a dentist for many years in London, a mercury-free dentist. So I've got a lot of experience with people in dental issues. So it can be so effective. And also people get very anxious around going to the dentist. So if you watch the video on anxiety, there's some great remedies there that you can use before you go to the dentist, particularly if you're fearful. A lot of people very, very fearful with going to the dentist. So there's some natural health tip for your teeth in generally for good dental health care. You may have tried this already, but it's really, really useful to do. So do this first thing in the morning before eating and drinking, and use a tablespoon of cold pressed organic coconut oil in the mouth. So you get scrape it out, it would be solid, and swish it around your mouth for 10 minutes. Okay, especially between your teeth as well, getting a really good swirl. And the coconut, which will be solid, will melt in your mouth. But it's good to do it for at least 10 minutes, but don't swallow any of the oil, okay? Because it will contain toxins, it will contain bacteria from your mouth. So spit it out into your rubbish bin or trash can, as you say in the States, but not in the sink. Not in the toilet, because when it solidifies, it will start to build up and it can block pipes. Okay, really important to do that. Please just get rid of it in the trash can, in the rubbish bin, whatever you want to call it, but don't spit it down the sink or in the wash basin because it will clog up the pipes. And then rinse your mouth out with water, okay? Rinse it out with water. I use a bit of salt water and swirl it out. Salt water is so great. It's such a great thing to use in the mouth. And what it'll do, it removes fat-soluble toxins and bacteria from the mouth. And when you spit it out, it all comes out with it. So it prevents things like gingivitis, inflammation of the gums, bad breath, cavities, tooth decay, and promotes healthy oral hygiene of the mouth for the teeth and for the gums. So I would say for all of you, do that as part of your daily routine. It's good to be doing things that enhance our health and well-being. We're going to talk about remedies, but that's often after people have got problems. So it's always good to try to maintain your health and well-being as much as possible. Okay? So before we go into the remedies, this is our website. Check us out. We do lots of different courses, home prescriber courses, practitioner courses, foundation, but also subscribe to our YouTube channel. All of our videos on YouTube channel are on there, from anxiety, depression, grief, teething. We've got a teething video on there. We've got lots and lots of videos. So please check us out and subscribe. And I think we're to about 830 subscribers. It'd be great if we get to 1,000 in the next 2 weeks. So that's a challenge to you all. So let's look at some of the homeopathic remedies. Okay, some of the homeopathic remedies that we can use for toothache. First remedy, Belladonna. So with Belladonna and the toothache, there's a throbbing pain in the tooth. That's worse when there's pressure applied. Great picture, really shows a good Belladonna picture. Painful swelling of the gums. This is when people get gum boils or an early dental abscess. This is when it starts to come. Very fast, sudden, intense. Remember, these are the keynotes for Belladonna. We've covered this in our fevers video. We've covered this in all different things. This is the keynote for Belladonna. Fast, sudden, intense. Sudden pain, especially the lower teeth and on the right-hand side. It can be specific for that. But if it's on the left and it's still got those keynotes, you can still prescribe Belladonna. Very sensitive to touch. All the senses get very, very acute. All senses become very acute to anything around their environment. They can get dryness of the mouth, but an aversion to water. They may not be particularly, want water. A lot of dryness in the mouth. Sensation of fullness and swelling in the infected part in the cheek. So it will feel swollen, it will feel full, and can have a bright, hot red face. Again, another keynote for Belladonna. Worse at night, worse for eating, worse for touch, okay? Worse for jarring if they suddenly jar. Again, big keynote for Belladonna, okay? And sometimes it can be better for biting on something. It can actually feel better for that pressure of biting on something. So that's Belladonna, those keynotes. Remember, throbbing, fast, sudden, can have redness, a lot of heat with Belladonna, as we know. Next remedy, Chamomile. So with Chamomile, the pain, remember the keynote of Chamomile is pain is unendurable. It's too much, it's intolerable. And they become really angry with the pain. It's too much. Highly emotional, oversensitive, temperamental, any slightest thing, they overreact to it, and very irritable. Nothing will please somebody who needs Chamomile. You'll offer things, no, don't want that. So you can't please them, but they're in a tremendous pain. It's like they can't stand the pain. Can have swelling or redness of the cheek. It's a bit like that Belladonna we talked about. But one side can look red, the other side can look pale. This is, again, keynote for Chamomile. One side red, the other side's pale, and it can alternate. The toothache gets worse during pregnancy. So this is for women who get toothache during pregnancy. Big remedy for that. Or during their menstrual period. Okay, so they get toothache when they're on their period. And it's also they can get toothache can be coming into a warm room, especially from a cold room into a warm room. But remember the pregnancy and the period, this is when women can get the toothache. The gums can be swollen and burning. There's a burning to them. They feel swollen and burning during the toothache. And they're better for cold applications, okay? Better for cold applications. They're worse for touch, worse for being looked at. Even if you look at them funny, they're like, what are you looking at? They're in so much pain, it's like, just keep away from me. Worse at 9 p.m. to midnight. Worse being cold, whereas the better for cold applications of the toothache, but the worse for being cold, okay? Worse for warm drinks, worse for coffee. Now, the worse for coffee because the whole nervous system is already very irritable. So the coffee will irritate it even more. Thirsty for cold drinks. So they want cold. But they may be chilly in themselves. But remember, if they're in intolerable pains, angry with the pain, nothing you can do satisfies. And again, check out the teething video where Chamomile is a big teething remedy as well for kids. So check that out on the YouTube channel. Next remedy is Hypericum. So you can see these dental instruments there, and anybody's got a fear of the dentist, they look at that picture and go, oh my goodness, it's awful. So this is toothache with a sharp shooting pain felt along the nerve. They can feel it going along the nerve. And it's a great remedy to take after dental work, or they've had a filling, or there's been an extraction. And often you take it alongside arnica. So you may give arnica first, and you may follow up with Hypericum. And this is injuries to the nerves during dental work where they've injured the nerve and you have terrible pain afterwards. But remember, the pain is sharp, shooting, felt along the nerve. They feel like the nerve's exposed, very, very sensitive. Extremely sensitive, almost out of proportion to the actual what's happened. These are people, this is a good remedy for people who have never been well since root canal work, very sensitive and painful since then. And we see this a lot in homeopathy, never been well since. Now remember, The clams I talk about, when you're taking a little acute case, even if it's something like this, you can do a little clams. And if you want to check out clams, go to the top tips on prescribing video on the YouTube channel. And I go through how to take an acute case. So even something like this, it's what we call an acute case. You have to take the location, the etiology, what was the cause, when did it start, what makes it modalities, what makes it better, what makes it worse, the sensation, is it stinging, sharp, shooting? Really important to get this information. Because you're like a detective, you're trying to get this information in order to know which are the remedies you need to prescribe. Now, never been well since with Hypericum, it's never been well since dental work. Again, where it could be root canal, it could be extraction. Really, really important. Worse for touch, worse for jarring, a bit like Belladonna. Better bending the head backwards. They get relief bending the head backwards. Keynote for Hypericum. And better lying quietly or lying on the affected side. So if there's pain on this side, they want to lie on that side. If it's on that side, they want to lie on that side. Better for that, for lying on that side. Okay? So this is the arnica of nerves. Remember this, arnica of nerves is Hypericum. When there's any trauma or damage to the nerves. And that's nerves anywhere in the body. Today we're talking about to do with dental work, but it can be anywhere in the body. Okay, the next remedy. Kefir cruda, coffee. Teething, this is good for teething in very sensitive children, so these Chamomile children. Toothache, again, during the menstrual period. So this is when toothache comes on in the menstrual period. Another good remedy, kefir. And you're gonna sort of do a differentiation between those two remedies. Whole jaw thing's really hypersensitive. The whole jaw is very, very sensitive. And again, severe toothache, intolerant to the pain out of proportion. Again, think of Chamomile. You're going to be differentiating between these two remedies. Oversensitivity of the mind and the nerves. Overreactive. So the whole system, the whole nervous system is so sort of sensitive. The slightest thing will affect it. Pain is better by holding ice cold water in the mouth. The colder, the better. So they'll put ice in there with the water and they'll hold it in the mouth and they get relief. Chamomile is better for cold drinks, but this is better for the cold ice, as cold as you can get it. But as soon as it warms up, the pain comes back. So they're going to have to keep going back to the refrigerator, get in the ice, back in it again. It's the thing that gives them relief. They're very restless, a lot of anxiety. The pain drives them to despair. And they may be weeping. Driving to despair and weeping. It's like they can't get relief except for when they have this ice cold water. It can also cause insomnia. Now this is a big remedy for insomnia anyway, kefir, when the whole nervous system is very wound up. But it's also for the toothache, which is causing insomnia. Worse for any type of noise. Very sensitive. Also worse for cold wind, worse for touch. Now they're going to want to rub it. They feel like, oh, if I only could rub it. But as soon as they touch it, it's like it's too much. It's too sensitive. It can be worse for any warm drinks and aggravated at night. And the warm drinks will aggravate it. They might go, just could do with a cup of herbal tea maybe. And as soon as the hot sets it off. Because they're better for ice cold water. Okay, so we said better for holding ice in the mouth, better for lying down, better if they sleep. If they can sleep, they feel better for it. Because again, the whole nervous system can relax. Strong aggravation from drinks, and you do not want to give them coffee. Okay, it will just aggravate everything a lot worse. Next remedy, Magfus. Now, again, hypersensitive with pain. Look at the picture. She's like, again, like Chamomile, but hypersensitive, shouting, screaming with the pain. And it's sudden, sharp shooting pains in the tooth. Okay? Severe neuralgic pain in decayed or filled teeth, where they're being filled with a filling. Severe neuralgic pain. Very restless, very nervousness. Again, with weeping and sobbing. Again, I'm not over-exaggerating. This is people in extreme pain. Extreme pain. And they're despairing with the pain. They think it's never going to go. Anxiety as well with the pain. fear of being touched if somebody comes and touches them. But the pain absolutely exhausts them. They're exhausted from the pain. And the teeth are sensitive to touch or to cold air. Now, the keynote for Magfus, and this is how you're going to differentiate it between the other remedies like Chamomile, better for heat, better for warmth. Okay, so they're for better for heat, better for warmth. They may have a hot water bottle on the cheek or on the tooth, or they may, again, warm drinks. It's going to make it better. Better for hard pressure, okay? Hard pressure on the area, on the tooth. Hard pressure, better for rubbing the area. Worse for cold water, worse at night, worse light touch. They need pressure, not light. The worse for light, want it really pressure. Worse for motion, worse for cold. Whether that's air, cold air, whether that's cold drinking, they are worse, absolutely worse from it. Okay? So always try this remedy for that. It's the heat thing, better for heat. Next remedy, Plantago. Now this is a herbal remedy. It's the #1 herbal remedy for toothache and bleeding and gums, but we can also use it in homeopathic potency as well. You may not get this in the health food store. You may get this from the homeopathic pharmacy, but this is in homeopathic potency. Again, we'll talk about potency later, like a 6C or 30C. And this is with toothache with earache. So the sharp pain goes from the tooth to the ear and back again, often along the trigeminal nerve, which goes to the eye, the ear, into the teeth. So it can go into the ear. And the teeth can feel long. They have this sensation that the teeth are too long. Strange, rare, and peculiar symptom. But very sensitive and sore to touch. Again, the nerves are very tender. Profuse saliva with the pain. They get a lot of saliva. They're wiping it away. And deep aching. If they've got a rotten tooth, there's deep aching in the tooth. Deep aching in the tooth. Toothache in cavities, decayed teeth with rapid tooth decay. Okay, so this is people where teeth have gone rotten. And a lot of people will have this tooth decay because they're scared of going to the dentist. They just don't want to have the dental work, and they will really suffer. Pain can shoot on the left side of the face, sharp stabbing pains, okay, with the pain. And sharp pains in the eyes. Again, strange, very peculiar symptom. They get pains in the eyes from the toothache, from decayed teeth. Better when eating, better when sleeping. Worse at night. Worse for touch, worse for heat. And can also be worse for cold. It can be worse for both. Okay? Can't often get any relief from either of those. So that's Plantago. Great, great remedy. And next remedy, Pulsatilla. This is toothache that is relieved, again, by holding cold water in the mouth or cool, fresh air. So again, we talked about the remedies, better for cold, better for heat. You're down to 2 or 3 remedies out of the Materia Medica out of 3,000. Okay? You then got to differentiate on the modalities. What makes it better? What makes it worse? What's the sensation like? With Pulsatilla, sharp shooting pains, which go from the tooth to the head, to the face, and also to the eye of only of the affected side. Okay, Plantago can go be in both eyes. Pulsatilla, if you've got pain in the left-hand side too, in the lower jaw or the upper jaw, and it goes into the eye of the same side. Okay, so it's a pain, shooting pain. Sensation if the tooth will be forced out or if the nerve are being stretched. They can feel like the nerve is being stretched or the tooth is going to be forced out. And again, the keynote for Pulsatilla emotionally is they're weepy and they're tearful. And they want affection and they want sympathy. You know, they're very soft Pulsatilla. They're not on the rah, like Chamomile. They're very soft, very, very weepy. They just want to be very clingy as well. They want to be near you. They want you to be around them. They want support. They want affection. Again, Pulsatilla worse in the evening. Especially twilight after sunset. That's a time modality for Pulsatilla. They don't like twilight. That in-between part between day and night. And also can be worse, the toothache from coming into the warmth from the cold. Because Pulsatilla is worse for the warmth of the room. Okay? Or the heat of the bed. It can aggravate them. They're better for open air. They need that open air. They don't feel suffocated. They might have a window open, but they'll feel better for it. better for cold applications, better walking in slow motion. They're better if they move around slowly. Whereas with Chamomile, they often will be better if they move around quite vigorously. Better for being carried if it's a child, and better for consolation, whether an adult or child. They'll feel better for being consoled. They want you to look after them. And they're thirstless. They don't crave any drinks, anything. They're very quite thirstless. So Pulsatilla, great remedy. Also was in my teething remedies that I talked about in the video. So let's look at a tooth abscess. So maybe the toothache's got beyond and it's being caused by a tooth abscess. So I'm going to talk about 3 remedies here. Top 3 remedies. Belladonna again. So we talked about the early stages of a dental abscess with Belladonna. This is where we are, just 1 second. Okay, so dental abscess in the early stage where pain is sudden, violent, throbbing, sharp, shooting, coming and going in repeated attacks. Calm, like that. That's Pulsatilla, tense, really tense, then comes off. I always describe Belladonna like it's like a storm. Comes in, comes out. Comes in, comes out as quickly. Dryness of the mouth, as you said, with a aversion to water, sensation of fullness and swelling in the effective part, and can have a hot red face. Okay, Hepatic sulf, very painful, sensitive, extremely irritable, extremely sensitive. And the abscess accompanied by pus formation. And it's like a splinter-like pain. Better for heat, worse for lying on the affected part and for touch and cold draft. It's a very, very chilly remedy, and as I said, very irritable. And then the next remedy is silica. Abscess at the root of the tooth, which is sensitive to cold water. And it's used to hasten the discharge, okay? When the pus is draining, it helps pus out the discharge. It's so effective for releasing that discharge. Worse for touch. So remember, silica is very, very good how it pushes things out. Just like a splinter, you have a splinter, you take silica, it will push that splinter out. It's great for doing that. Great in abscesses as well. So that's just 3 top tooth abscess remedies and different stages. Again, there's lots of different remedies for toothache and tooth abscesses. Again, I'm just giving you some of the top ones that you should know about. Okay, let's talk about tissue salts or cell salts. I'm going to talk about 2 tissue salts or cell salts, depends on what you call them. They're the same thing. Again, you can buy these over the counter at health food stores, homeopathic pharmacies. And I'm going to talk about 2, Calflor and Calphos. Now, I love tissue salts. They're so effective. I use them a lot. I use them in young children. I use them myself. I use them on animal. So many uses for them. And I always imagine them like homeopathic minerals. They're prepared in a different way, homeopathically prepared in a different way by the pharmacies. But let's talk about Calflor. So Calflor strengthens the tooth enamel. Okay, the enamel around the tooth. And so this is really useful for children who get teeth decay or get cavities easily. Okay, so it's good as you can give it to them every day or twice a day, like a maintenance program, sometimes for 2 or 3 months. Okay, deficient enamel causes the decay. So the enamel's weak, and the Calflor will help strengthen that. Really good for sensitive teeth, both chronically and acutely. And the great sensitivity from eating or touching the affected tooth. And this is also good for people where teeth or kids the teeth come through and they're rotten and crooked and deformed. It's like there's some kind of mineral imbalance here. And Calflor is a great remedy for that. So you can give it to the kids and the new teeth will come in better and better. So if you see it with the baby teeth, maybe you'll give it, you give it when the second teeth are coming through, and it will help a lot. And often I said, you can give it from, well, I said 2 or 3 months, you can give it from 3 months to 6 months as well. It's just really good for young children and also for the elderly. These are really good salts. They're like maintenance, things you can take all the time. Often, normally with homeopathy, you give the remedy, you stimulate the body to heal itself, and it's fine. Tissue salts are different. Again, think of it more as a nutritional type of homeopathy than the normal homeopathic remedies. Next remedy, Calphos. Again, we normally get this in the 6x potency, like Calflor, 6x. And it's an important remedy for growth and development anyway, especially for children. And it affects the nutrition of the bones and the teeth. So calc-flor, as we said, is good for the enamel, the outside. Calc-phos is good for the inside structure of the teeth. Okay? It's good for that inside structure of the teeth to strengthen them. So it's a great remedy for bones and teeth. You know, again, you can give this to kids. It's so, so good. But also you can give it to people at different stages of their lives. Slow or difficult teething, you're having problems, difficult teething or slow teething or teething that is delayed. I remember my mum saying to me, I was about 18 months old before I got a tooth. I was running around with I had blonde hair those days, running around. She said, and I smiled and I had a big gummy smile. Very calc-phos, extremely calc-phos. Also, I broke my arm and bones quite a lot as a young child as well. That was the remedy I needed at the time, calc-phos. So they often have an issue cutting teeth through the gums. Again, think of also wisdom teeth. Don't just think of children cutting their first or second teeth. Think of wisdom teeth as well. And it's also good for teeth that decay early, like calc-flor. Well, I hope you can see the difference between calc-flor and calc-phos. Calc-flor is for the enamel, the outside. Calc-phos is for the inside. Okay, for the inside. So the question I get asked all the time is about prescribing. So I always like to put this slide in. In this situation, the toothaches, tooth abscess, again, you know, 6C, 30C potency, these are good remedies you can get over the counter at health food stores or in the remedy kits. And again, in an acute pain, you give one dose every 15 minutes for 3 or 4 doses or until the pain subsides. Okay? And remember, you're looking for the keynotes of the remedy. Again, if you had to play a song, if you play those few notes, 3 notes, you'd recognize the song. Same with the remedy. Looking at major keynotes that we've talked about in those slides. You don't need every single one of them to prescribe. But you're looking for at least 3 strong ones. They think, yeah, that's the remedy. But even if you're down to 2 or 3 and you can't decide and you go into analysis paralysis, choose one. Just give one. And if it works, you'll know within 15 minutes whether or not it's had an effect. Now, you may give it, it's better, and then the pain comes back after 15 minutes, repeat it again. And it may go for 30 minutes and then the pain goes back. And then next time you do it, and then go for an hour. So just adjust it to the body. What we're doing is stimulating the body to heal itself. So you're watching how the body deals with the remedy after we stimulated it. And if symptoms persist, always seek a qualified homeopathic practitioner, especially if it goes on and on and on, and there's long-term issues with the teeth, or you can't seem to resolve it, then please do seek the advice of a homeopathic practitioner. Check out the YouTube channel, subscribe to that, and also look for all the different information we have on our website. We've had a lot of emails and people sending messages in about other courses you can do. Yes, you can we do a foundation course, which is a year-long course where you deepen your knowledge on homeopathy. We also do practitioner training as well. 2-year fast-track training to be a qualified practitioner, or 4 years part-time. If you can't do fast track, if you're working and you've got family commitments, then we do a 4-year course as well. So, and we'll send you details of the next open day event that we're having, but we're recruiting now in September. Get your applications in. You can go to the website if you're interested. There's still some places left. Okay, everybody, take care. Bye-bye.